So your pet is going to have surgery. Here's what to expect. Presented by New York Veterinary Specialty and Emergency Center. Quality medicine and compassionate care. For more information, go to www.nyvsc.com. Once you've made the emotional decision for your pet to have surgery, the most difficult thing you face is the unknown. This video is meant to try and ease some of the anxiety by helping you to be as informed as possible. That being said, there is nothing more valuable than your conversations with your surgeon. Be sure to let them know when there is anything you're having difficulty understanding. It also can be helpful to write down your questions beforehand so that you don't forget anything during your consultation. To summarize, pre-surgery exam and diagnostics are needed. Be sure your surgeon knows all medications your pet is on. Stop food at midnight and pick up water when you wake up. Continue all medications as normal unless otherwise directed. Drop off early in the morning or the night before at no extra cost. We will be shaving your pet's fur in various locations. Your pet may not be hungry for a couple of days after surgery. Post-surgical care will focus on pain management and avoiding infection. Aftercare is vital to your pet's recovery. An e-collar can keep them from chewing at their surgical site. Ask any questions about your pet's medications or treatments. Let us know right away if there are any concerns. Pre-anesthetic exam, blood work, and x-rays. It is vital that prior to any anesthetic procedure we have an up-to-date physical examination and blood test results. The pre-surgical physical exam will always take place the same day as the surgery. The blood work will allow the doctor to identify potential concerns and help them make adjustments to providing the safest care possible. How close to the day of surgery this blood work must be performed can vary depending on the patient's age and health status. Regardless, all preoperative blood work must be done within 1 month of the surgery, and the surgeon will let you know how close to the procedure it must be performed. Preoperative blood work and some x-rays can be done at your regular veterinarian. The night before the surgery. Any medications that your pet is currently taking should be continued as normal unless specified by your surgeon. Be sure to make a list of what your pet is taking, when and how they are taking it. Food and water. Feed your pet as normal and then pick up any food or treats at midnight. They can still have some water overnight and remove the water when you wake up. Patients should not have a full stomach when they arrive. On the day of surgery. The time of surgeries are established after all pets have been admitted that day. The times may be altered in the event that an unexpected emergency arrives. We request an early drop-off so that we can begin pre-surgical procedures. Why are we shaving so much of your pet's fur? We must shave the sites completely in order to be able to properly sterilize the surgical site, as well as for the IV catheter and other locations. Once they start waking up. After the surgery, the surgical technician will transfer your pet to an assigned kennel and continue to monitor them as they awaken from anesthesia. The breathing tube will be removed during this time. There can be soreness and discomfort for a day or two from the endotracheal tube. That can make some patients reluctant to eat. After the surgery. The surgeon will have a personalized treatment plan for your pet after surgery that will consist of instructions for the ongoing assessment and care of your pet with the intention of meeting their pain management and treatment needs. Your pet may not defecate after surgery for 1 or 2 days. Do not be concerned unless they are straining to defecate. They should urinate within 24 hours of the surgery. We discourage visiting on the night after surgery. It can be very stressful for your pet for you to visit and then leave. It is critical that visitation not interfere with your pet's recovery, nor with our ability to provide care to other patients, including unforeseen emergencies. We appreciate that you have a busy schedule, and we will try to accommodate you as best we can. Visitation is always at the discretion of the doctor. When can your pet go home? They cannot be discharged until after the morning team has made the final assessment based on the overnight team's observations. At-home aftercare. After all surgeries, aftercare will need to be provided at home. It is critical to your pet's recovery that you understand and are able to provide this care. At the time of discharge, the technician will go over all medications, treatments, and restrictions. You will be provided with a written discharge instruction sheet. You have made a huge investment in your pet's health care. It is vital that you are able to continue this care at home and that you do so consistently. We are here for you to make sure that you have the proper tools. If you are unable to give medications or doses are getting missed, please contact us for guidance. If they don't get all the medications, all the times they need it, and all the days they need it, it may slow down or stop recovery. What to expect down the road. All surgical patients will need to come back for a recheck appointment. The recheck exam is done at no cost. If there are any follow-up diagnostics such as radiographs, blood work, or bandage changes, there may be charges for these services. Any additional medications will usually incur charges. If you have any questions about this, please ask your surgeon. Depending on your pet's surgery, you may be asked to return with them for more than the standard recheck appointments. This could include physical therapy, hydrotherapy, splint changes, gait analysis, etc. The costs of these anticipated services are usually included in the original estimate. A critical factor in the success of any surgical procedure is the healing process. It is very important that you follow all postoperative physical restrictions and at-home treatments, as this is an extremely vital part of your pet's healing. It is very important to supervise and use e-collars as necessary, as well as adhere to physical restrictions, play, exercise, jumping, running, stairs, etc., to avoid any complications, such as postoperative infection, re-injury, and self-mutilation of the surgical site. Please be aware that any complications would involve additional care and possible charges. Is the surgery guaranteed to work? Unfortunately, no one can guarantee any medical procedure. Like all medical treatments, there is no way to predict with 100% certainty how your pet will respond to medications, how well they will heal, or whether time and activity will result in a full recovery. But we will do everything possible to have a successful outcome. Thank you for trusting us to help you and your pet. Thank you for watching. So your pet is going to have surgery. Here's what to expect. Presented by New York Veterinary Specialty and Emergency Center. For more information, go to www.nyvsc.com. To see more videos, go to www.nyvsc.com/client-education. Please like us on www.facebook.com/nyvsc.com.